Good afternoon. Welcome to the briefing for Tuesday, October 13th, 2020. My name is Joe Doherty. I'm with the Utah Department of Public Safety. It's my pleasure to introduce Governor Gary Herbert, Dr. Angela Dunn, the state epidemiologist, and Rich Saunders, the director for the Utah Department of Health. Governor Herbert.
Thank you, Joe, and thanks again to our media people who are helping us get information out at our press conferences to the people of Utah. We thank you for that. 7 months have passed since we had our first recorded case of the coronavirus in the state of Utah. So much has changed in that short period of time. Today, we recorded 987 cases, and our case counts have been hovering around 1,000 per day since October the 4th. I join with you in praying for a safe and effective vaccine that will allow us to resume our more normal patterns of life. I also pray for improved treatments to reduce the severity of the infection when it does hit. I, like you, am tired of 2020. I'm tired of emergencies and social distancing, of the loneliness, the anxiety, and the worry that each of us face, and most especially of the heartbreak and loss this virus has inflicted on families who have lost loved ones. But Utah is now facing its most dire episode yet in this epidemic, and frankly, it doesn't matter how tired we are. We must, in fact, win this fight. Our infections are at an all-time high, although Utah has been blessed with one of the lowest mortality rates in the country, and we pray that it will stay that way. The dramatic increase in infection has put the integrity of our healthcare system at risk. You have heard about the sheer exhaustion experienced by our amazing healthcare professionals. That has been a challenge for our medical professionals, even at the much lower rates we've had in the past. As our hospitals and ICUs near their maximum capacities, too many vital medical procedures and treatments are at risk for cancellation and delay. Some of our hospitals are already load leveling, which means that they are moving patients to different facilities and even between health systems to accommodate their needs. At this very moment, our Utah Department of Health and the National Guard are on standby to open up a field hospital at the Mountain America Expo Center in Sandy. I appreciate if you and your family have been spared from the direct impact of coronavirus infection after 7 months. You may have become just a little bit numb to the daily case counts and the dire warnings. But as we look at our current situation, this is a moment to evaluate what has worked in the past, what has not, and the adjustments that we need to make in order for us to win the contest against COVID-19. So here's my evaluation. We had a strong first quarter in this contest against the virus. Together, we moved swiftly to take steps to stem the spread. Our rates of infection were blessedly low, and we kept most of our economy open. That bought us time to secure the kind of supplies of protective equipment that were initially in short supply. It also helped us develop testing capacity and a better understanding of the virus. Monetary and fiscal stimulus helped keep commerce flowing. And although we had to stay apart, we worked together. And if you were like me, you believed that a short season of sacrifice would allow us to win in the long term. But our second quarter has been rough. The virus has had a midsummer surge with up to 670 new cases per day. And although we were weary, together we rallied once again to take the extra precautions of physical distancing and mask wearing and proper hygiene and showing consideration for our neighbors to help drive the 7-day average down to 344 per day. We even had our lowest numbers of COVID patients in the ICU units at our hospitals at 8%. Unfortunately, over the last 4 weeks, we have seen our infection rates and case counts skyrocket to the highest they have ever been. Our case counts have hovered around 1,000 a day. Our percent positivity is now over 13%. And worst of all, our hospitals are getting overwhelmed, and our healthcare workers are getting stretched too thin to provide the best possible care. We're now utilizing 15.8% of our ICU beds to treat COVID-19 patients today, and our total ICU utilization is now at 69.6%. This leaves our hospitals precariously close to being unable to treat COVID patients in need of critical care, and to also provide emergency care to Utahns experiencing other life-threatening conditions. The University of Utah's ICU is now at 95% utilization this week. We're having one of the worst outbreaks in the country, and this is unacceptable. You and your families deserve good health and the best efforts from the government to help you to go back to normal activities as soon as is possible. It's really time for a new game plan. We have to make some adjustments. As a state government, we owe it to you to make critical decisions about the COVID-19 pandemic based on critical health data, not based on fear, and certainly not based on politics. So working collaboratively with our state and local public health professionals, our education sector, our legislative leadership, and the business community, and many others, we've worked to create a new game plan for Utah's second half of this contest. So today I'm announcing a new system that will provide trusted guidance based on epidemiology and medical science. This guidance system is based on the calculated amount of infection and transmission that happens in our communities and provides Utahns with concrete actions to help stem that spread. It empowers our local health authorities and local elected leaders to make unique decisions to improve conditions in their localities. Every week, the Utah Department of Health will analyze 3 key data points for each county. Based on that data, each county will automatically be categorized as a high, a moderate, or a low transmission area. Dr. Angela Dunn will now explain how a data-driven transmission index will guide our categorization of counties in the state. After, Rich Saunders, who leads our Department of Health, will then explain the kind of concrete actions that we will all need to take in order to reverse our dangerously high transmission rates. Dr. Dunn?
Good afternoon. Thank you. And as the governor mentioned, the new COVID-19 transmission index, it really simplifies and clarifies the health metrics that are going to be used to determine which counties are going to be placed in which transmission level. And these metrics are the result of conversations among a lot of stakeholders: public health, healthcare systems, legislative leadership, the governor's office, and many others. So beginning today, counties are going to be placed in one of 3 transmission levels. They can be high, moderate, or low. And these levels directly correspond to case rates, percent positivity, and statewide ICU utilizations. As Governor Herbert said, we're going to analyze this data weekly, and counties are going to be categorized according to each metric and where they fall. For a county to be placed on high transmission, it requires a 7-day percent positivity of greater than or equal to 13%, a 14-day case rate of greater than or equal to 325 cases per 100,000, and a total statewide ICU utilization that's greater than or equal to 72% and 15% or greater utilization from COVID-19 patients specifically. So moving on to moderate transmission category, it's going to require a 7-day percent positivity between 6 and 12.9%, a 14-day case rate between 101 and 324 cases per 100,000 population, and a total statewide ICU utilization between 69 and 71.9%, and then 6% and 14.9% utilization from COVID-19 patients. And finally, for a county to be placed in low transmission category, it's going to require a 7-day percent positivity of less than or equal to 5.9%, a 14-day case rate of equal to or less than 100 cases per 100,000 population, and then the statewide total ICU utilization has to be less than or equal to 68.9% and 5.9% or less utilization from COVID-19 patients specifically. So counties are going to be able to move from lower to higher transmission levels every week, but counties can only be moved from higher to lower levels after spending a minimum of 14 days in that higher level. The coronavirus.utah.gov website, it's going to be updated every Thursday, and it's going to reflect which counties are at which level, along with the data to support why each decision was made. So now I'm going to turn the time over to Rich Saunders, who's going to discuss exactly how each transmission level results in specific public health interventions. Thank you.
Thank you, Dr. Dunn and Governor Herbert. It's good to be with you all today. I will note that just one nuance to the information that Dr. Dunn just gave is in order for a county to move, it requires two of the three metrics that she announced to hit that threshold before the trigger happens. So two of the three metrics are required. And over the past 7 months, science and data has determined a few main concepts that have proven effective against the virus. Many of these simple and well-known concepts are central to this new approach. Physical distancing is an example of these main concepts, especially when around other household individuals. Another concept that's proven through science and data is practicing good hygiene makes a difference. Staying home when you're sick and following public health guidance on isolation and quarantine protocols. These are very simple, and that's the beauty of this, is that these are so simple we can all do them. Another concept that has been proven through science and data is that wearing masks when you're around other individuals or groups outside your household works. So I know that masks are controversial. Some people make political statements by either wearing them or not wearing them. But if you take the politics out and you look at the science, masks just work. They're not the save-all. They don't do everything we need, but they work. So while these are simple behaviors, they're actually high leverage behaviors, meaning that if we all are vigilant in doing these things, we'll be very successful at properly fighting back against the virus and its impacts. We've also learned that when we all focus together on something and engage in that focus, we can change just about anything. For example, when the people of Utah County adapted their behavior, they actually reversed the course of the surge in that area. Why? Because they focused on it. Businesses have learned how to function successfully in the new environment of this pandemic as well. Hundreds of businesses have actually helped the Department of Health create a manual that can help all organizations safely operate during this pandemic. And as a reminder, that's available on the coronavirus.utah.gov site. So businesses in this new model are expected to continue practicing safe operations, and each of us has the responsibility to evaluate which businesses operate safely and frequent those businesses. The Stay Safe to Stay Open symbol displayed at a place of business is assigned to patrons that they can count on that organization as practicing certain protocol in creating a safe place to shop or to eat. There are similar pledges which are also helpful in this way. The Restaurant Association, for example, has a pledge. So look for those symbols to help make decisions on which businesses to frequent because they are committed to providing safe practices. So over this past 7 months, we've had a very good success record under the color-coded phase guidelines, which the governor said we are retiring these today. And today we're announcing a much simpler approach under a public health order. The new system is based on the transmission index, which calculates the level of COVID-19 transmission in each county by analyzing the 3 data points that Dr. Dunn described. She's been very instrumental in helping us through the epidemiology behind this new system. And as she said, many stakeholders have been involved in trying to decide how this will come together and work effectively. It's been impressive to see the collaborative effort, an opportunity for us to come together. And that's what we're hoping we will all do, including each one of you. We know precisely how to limit the spread of the virus. Now we just need to do it. This system will help us to determine precisely that by simplifying the behaviors we need the public to follow in their communities, depending on whether they live in a high or moderate or low transmission area. The transmission index represents the collaborative work of so many people. I'm just thinking through how many hours have been placed by so many people to figure out what to do to curb this situation that we're in. And I want to express thanks to each of those who have come together to do this. It has been done with great hope to change the circumstances that are around us, and I'm confident that that will happen. It's a comprehensive, it is comprehensive in what it asks for the public to engage in, and places new requirements and expectations upon each one of us, as I've just stated. When we're fighting against the virus, we need to work together. And the new COVID-19 transmission index zeroes in on adapting behaviors that will get us the most bang for our buck in curbing the coronavirus infection. I've mentioned that these are high leverage activities, that if we do them collectively, they'll make a big difference. So rather than focusing all the what to do's and what not to do's, we're focusing on key principles, as I've explained earlier. There's a lot more expectation and burden placed upon businesses and upon the individuals. So here's the basic restrictions and the recommendations when we look at them at play. First of all, there's a focus on masks and masks being required, which are based on the level of transmission in your area. In general, we ask that masks be worn no matter what the transmission level in your area. At this particular stage in the virus, we are trying to work through the life cycle of this virus, and because of where we are, we're asking that masks be implemented wherever possible. We ask this because they help, just simply put. The scientific evidence shows us that mask wearing significantly reduces the transmission of the COVID-19 from person to person. For now, masks are required across all transmission levels when attending events of public gathering. So, for example, like a theater, a sporting event, a live concert, or a wedding, anywhere where people congregate together for an event, masks are required across all levels. Additionally, in counties designated as high transmission areas, masks are required in public indoor settings and outdoor when physical distancing is difficult to maintain or not feasible. For example, this would be like at a store or the library, in contrast to what I've just stated earlier, where all people will be required to wear them at events where groups of people gather together. So in counties that are designated as moderate or low areas, transmission areas, masks are still strongly encouraged at this point in the pandemic. And county executives are empowered to require masks on their own with the consultation with the local health officers. So in addition to mask requirements that were already in place prior to today's announcement, those will remain in place. This includes mask requirements in Grand County, Salt Lake County, Summit County, and Utah County. It also includes the requirement of K through 12 schools and the mask requirement in state-owned buildings. There's been a lot of talk about masks in the last 2 minutes. Because masks are an easy step, an easy tactic to make a big difference on the virus and the spread in the community. So secondly, there's a large emphasis on this new system on controlling the spread at casual social gatherings. I would tell you that this is a very large problem in our state. And a casual social gathering refers to the wonderful and important gatherings of family and friends. This includes hanging out with groups of your high school or college friends. Basically, gatherings that don't have establishment or organizational oversight. These are different from public gatherings, which include venues such as movie theaters, performing venues, concerts, weddings, sporting events, and religious services. Those are referred to separately as public gatherings. So in my remarks, you'll hear a reference to social gatherings, casual social gatherings, and public gatherings. And these are defined as I've just stated. So we believe that casual social gatherings, as I've defined them, are responsible for a significant amount of the spread that we're currently experiencing. So we're trying to focus on those types of venues or environments. We have to start thinking about these smaller casual gatherings a little differently. While it may be true that in casual social gatherings we're usually among trusted loved ones and friends, the virus knows no boundaries. And because we let down our guard in these settings, it's a popular point of viral spread. The virus doesn't care how much we love to be around each other and how much fun we want to have. This is why, under the new system we're announcing today, there's such an emphasis in this category. So far we've got masks and casual social gatherings as key areas of emphasis. Casual social gatherings are limited to the following sizes. In counties designated as high transmission, casual social gatherings, as I've defined them, are limited to 10 or fewer people. And you have to ask the question, our goal is not to separate families or friends or to remove fun and social things that are so important to humanity. Our focus is right now during this pandemic to make an adjustment because it makes a difference for our long-term future. In counties designated as moderate transmission, these gatherings are limited to 25 or fewer, unless masks are worn. And in counties designated as low transmission, these gatherings are limited to 50 or fewer, unless masks are worn. Again, casual social gatherings are an incubation area or a point of transmission that is problematic in this pandemic. So please make note of that as the second area of focus for this new system. A third area in the new system places the following restrictions and recommendations on public gatherings. Now, again, I want to emphasize that there's a difference between public gatherings and social gatherings. And this category, public gatherings, influences any establishment or organization that allows public gathering, including but not limited to movie theaters, performing venues, weddings, recreation venues, religious services, sporting events, whether those sporting events are youth, collegiate, or professional. These events can be held in all transmission levels when masks are worn. As I explain additional nuances, please note that there is less emphasis on defining how many people may attend an event of this type, and more emphasis on physical distancing and mask wearing while at these events. In counties designated as high transmission, attendance is limited based on the event organizer being able to ensure 6-foot distance between household groups. All patrons, spectators, and guests must wear masks. And again, that's in all levels, high, moderate, and low. Now, performers at these venues are exempt at these events. Local elected officials are permitted to grant exceptions to this physical distancing guideline in high transmission areas, but these exemptions should be rare and are strongly discouraged. We encourage good judgment to be used in these discretions because venues can be successful where good principles are practiced. In counties designated as moderate transmission, all patrons, spectators, and guests must wear a mask. Performers, again, are exempt. 6-foot distancing between household groups is to be maintained. The difference here is that exemptions may be more common in a moderate level, though they're still discouraged. Again, businesses that practice key principles can safely operate even under these exceptions. The important thing here is to have a plan to adhere to safe protocol and to follow that plan. And that means the organization itself and its employees, as well as the patrons that frequent those events. And in all counties designated as low transmission, masks are still required at these larger public gatherings for all patrons, spectators, and guests. The performers, again, are exempt. Again, into the low level of transmission, because at this stage of the pandemic, we just still have to approach it this way. It's not permanent, but for now, this is where we are. 6-foot distancing between groups is still encouraged, but side-by-side seating without physical distancing is allowed in the low level. No exemption request is necessary. And again, all are wearing masks, practicing the sanitization and hygiene principles. Stay home when you're sick. Finally, all businesses are expected to operate under the same safety protocols, regardless of the level of transmission in their county. These standards, which I'll go over in just a minute, have been established through the use of the phase guidelines. I think businesses have become very intelligent on how to use these principles to successfully manage their operations. Requiring 6-foot distance between household groups is one of them, unless masks are worn. posting signage that lists COVID-19 symptoms and asking employees and customers with symptoms to stay home and encourage physical distancing, offering alternative pickup options when possible, such as curbside pickups, delivery, and takeouts for goods and services, facilitating employees to work from home when they are ill or in a high-risk category. Otherwise, encourage them to come to work and to participate as is feasible to the operations. Furthermore, the following requirements and recommendations apply to restaurants, bars, and buffets. In counties designated as high transmission, 6-foot distancing must be maintained between all parties at all times. In the waiting areas, in counties designated as moderate transmission, 6-foot distancing between parties is strongly recommended in restaurants and buffets, and occupancy is limited to 75% of capacity in bars, and patrons should wear a mask when intermingling with other parties. I know that sounds a little odd in a bar, but bars are nationally a problem. So we're asking even in bars that we make some adjustments in order to address this. And in counties designated as low transmission, 6-foot distancing is strongly encouraged in restaurants, bars, and buffets. So if I could just pause there and say, this is what that might look like in a restaurant in moderate. You might go into a restaurant in moderate and find tables closer than 6 feet. Hopefully they've taken the stay safe to stay open pledge. They're practicing correct principles. And we as patrons are masking as we go. When we sit to eat, we can remove the mask and enjoy the meal, put the mask back on as we leave. And the restaurant operations conduct safe protocol for hygiene and sanitization. That's what that might look like in moderate and low. We also strongly encourage businesses to sign the Stay Safe to Stay Open pledge, or a similar pledge, as I've stated earlier. This framework will be adopted in a public health order, which will be issued on Thursday. Changes to county designations, as has been stated earlier, will be announced weekly. And again, I want to emphasize that counties may move to a higher level of restriction based on the data weekly, and may move to a lower transmission level every 14 days to demonstrate a little more stability before we move to a lesser transmission level. In any case, the data outlined by Dr. Dunn determines what level a county will be in, and based on this week's data, the following counties are in high transmission areas: Cache County, Garfield County, Juab, Salt Lake, Utah, and Wasatch counties. The following counties are moderate transmission areas: Box Elder, Carbon, Davis, Grand, Iron, Millard, Morgan, San Pete, San Juan, Sevier, Summit, Tooele, Uinta, Washington, and Weber counties. And the following 8 counties are in the low transmission areas: Beaver, Daggett, Duchesne, Emery, Kane, Paiute, Rich, and Wayne. Finally, Utah's outbreaks are spinning a little bit out of control. We need to do something right now. So we're referring to this as a circuit breaker. There's a surge. We need the circuit to be broken to protect the infrastructure. We need the circuit breaker to stop this damage and make some sort of an impact in a significant way. It's like increasing our dosage. And I want to be very clear that if we work together, we all have all the hope in the world, and we will be very successful at this. It's been demonstrated by our ability so far to be so successful. And in the governor's analogy, we're having a halftime strategy change. We have the winning most record, or among the winning most records in the country. So we need to remember that. We're champions and we can do this together. So as the circuit breaker, the following requirements and directive will be in place for a period of 2 weeks beginning Thursday, October 15th, and ongoing through October 29th. Again, this is a all call, all hands on deck to make this change. And it will change the trajectory of our situation. There's nothing magic about these except they're so simple that if we do them, the change will happen. So in addition to the requirements that all persons living in high transmission areas wear masks in public places where social distancing is not feasible, and that masks will be worn at all these public gatherings, regardless of the transmission level, in addition to that, we're issuing a directive to all persons living in moderate transmission areas to also wear masks in public places where social distancing is not feasible. Again, more about masks. Why? They're simple. They allow the economy to keep going. They allow us to function near normal, but they're very effective. The Utah Department of Health is issuing also a public health order that all persons living in high and moderate transmission areas are limited to casual social gatherings to 10 individuals or fewer. Again, this is for the next 2 weeks so that we can get a jump start on this and suppress the momentum of this virus. So this is a lot to take in. The details are on coronavirus.utah.gov. We invite you to go visit the site to familiarize yourself more with this information. These changes are now live on the website as I speak. In a time where nobody seems willing to be able to agree on much of anything, and believe me, that is an understatement, I think we all look forward to the day where we can once again see each other's faces, shake each other's hands, hug each other, and do so without fear or feeling awkward or odd. Following the guidance provided in this new system that the governor has authorized and helped to orchestrate with all of us and the stakeholders involved, which now includes you, will help us to get there to where we need to be. Our announcing this new system is of no real value without your engagement. It means literally nothing. We have to literally change behavior. We can't just have it as a nice idea and something to complain about or feel like is being imposed upon us or that we're being controlled. These are sound principles that if we will apply together, it will make a difference. An example of what I'm talking about in making literal change, and until change happens, we already know where we're headed. Change will make the difference. And here's an example. I met with a few of my family last night. We have a little granddaughter's birthday party that is scheduled for this weekend. And we talked about it, and we live in an area that is designated as high transmission level. We are now changing our plans, modifying that event so that we can abide by these principles. Will the granddaughter go left unloved? Absolutely not. I can guarantee you that. But we'll make the modifications necessary to be successful and unite with all of you in making the good things happen that will result of this. It's a sacrifice, but it's worth it. We invite all of you to engage with us. And my thanks to everyone involved to make this, to develop this new system to where it is today. Governor, back to you.
Well, thank you, Director Saunders and Dr. Dunn. We appreciate the work that's been put on. This has been, for the last week, a 24-hour round-the-clock effort by many people, and we thank all who helped us to get to this point with this new plan. And this new game plan uses health data to guide how and when we move between different kinds of restrictions. It emphasizes the role of local health authorities and local government leaders in managing this health emergency. And I'd like to express my gratitude in advance to Utahns for obeying the public health orders and directives that will be issued by the Utah Department of Health this week. The gathering restrictions and the mask requirements and directives announced by the Utah Department of Health are designed to break the spike and to bend the curve. The battle against COVID-19 has been far too political in our nation. I'm grateful to the Utah Department of Health for crafting this plan, which will take political complications out of public health decisions. As part of this effort, I'd also like to announce that I will transition Utah out of a state of emergency and into a public health emergency this week. This is simply a different legal designation declared concurrently by the Utah Department of Health and myself, but this allows us to focus only on the public health needs of the people of Utah. This new game plan has come out of 7 months of hard work and lessons that we've learned along the way. I'm certain we'll be learning more lessons in the coming days and weeks, and we will adapt as is necessary. I have tremendous faith in our ability as Utahns to make the right decisions in order to keep each other safe and keep our schools and our businesses open. The hard truth is that we have learned that COVID-19 spreads most often in places where we are most comfortable, at informal gatherings with our family and close friends. Gatherings like these are the weakest links in Utah's outbreaks. We don't think that anyone we love and trust would pass this virus on to us, but this silent, invisible, airborne virus wants to use our love and kindness as a pathway to spread the infection. We can all control our own destiny by changing our behavior. By obeying restrictions outlined by this new data-driven system, we will see fewer infections. We'll maintain our lower mortality rate, and we will help our overwhelmed doctors and nurses and save lives and prevent the long-term health implications that some face after contracting COVID-19. If we don't make use of this guidance, Utah will continue to be one of the worst hotspots in the world for this infection. We don't want that. But we have stemmed the tide of infection before, and we will do it again now. Let's flatten the curve and reduce our numbers so that we do not overwhelm our healthcare system. We can all find ways to do a little bit better. All of us can find ways to do better than what we're doing today in our fight against this coronavirus. Let's all commit to being a part of the solution and not being part of the problem. Some of it's about attitude. In doing so, we'll be able to slow the spread, keep our economy improving, and improve our quality of life. With that, we'll now take a few minutes for some questions.
Hi, Governor. It's Ben Winslow with Fox 13. This is obviously a lot to take in, but your requirement on masks, is this a mask mandate without having a mask mandate?
Well, you can describe it how you want. I think we have mask mandates, but we're also asking people to do the right thing for the right reasons. It's a combination, maybe. We've expanded the mask mandate. And again, it's something that we know that we can help slow the spread. It's not a cure-all. But it is something we can do without impacting negatively the economy. It's a way to help slow the spread and reverse the trend that we see, the spiking that's going on. And we need to do it now and do it soon, or we're going to overwhelm the hospital situation in healthcare.
Is there any enforcement mechanism, though, for, say, people who violate these limited gatherings or things? You're doing this through a public health order, which obviously has some different teeth to it than just, say, you doing it.
Well, we have orders already in place. What we've all said we think have worked. At the end, it hasn't been perfect, but I don't know of anybody that's been cited, arrested, or fined in any of the places where we have a mandate already in place by the local government. So we're doing a similar thing. I don't expect there's going to be a lot of police out looking for violators. It's a matter of it's an ordinance. It's an order from our Utah Health Department to help us all be safe and to keep our economy going. There's nothing bad about this. This is a good thing. We all ought to say with our own volition, our own choice to in fact comply with the order being issued by the Utah Department of Health. Next question.
I also would like to ask for, I guess, a bit more detail on what the plan is for enforcing this. I know that, for example, in Utah County, when they implemented a mask order, one of their law enforcement agencies came right out and said they were refusing to enforce it. And I mean, if it is deemed a threat to public health and safety, if like a group of 100 people get together for a wedding, no one's wearing a mask, and it's in a high, a high infection index location anyway, is there no mechanism to enforce it or to require the party to put on masks or disperse?
I'll let Dr. Saunders talk about that, but sure there is. But again, the process we have here is trying to devolve the authority and responsibility back to the local government people. They can make those determinations of how to implement the programs and how to enforce it. We don't want to have to come to the governor's office and say, "Mother, may I?" We want more responsibility transmitted to the local government levels. They respect and understand the regional differences they have there, and they're going to watch those numbers. If they go up, people are going to be upset. Why are our numbers going up and putting us into a high-risk definition? We want them to go down into moderate and low. And I expect that they'll hold their local elected officials, the people themselves, accountable. And they'll work with their local health departments to determine how to do these things to enforce and to make sure that they, in fact, have the right policies in place. Dr. Saunders?
If you'll notice in the details, the masks are required no matter what level when public gatherings take place. That's designed that way on purpose so that when we have large groups of people coming together, we can reduce the risk of spread one to many. That is just a simple public health practice that we have placed in the order. Now, the other area where masks are required is in the high risk or the high transmission level. We're all getting used to the new language. And that pertains to public places such as a store or a library. And that's required. But when you get into moderate and low, it is not required. In the retail and those types of public environments, we're still encouraging the mask to be worn, but it's not a requirement. So, for example, if I were to go shopping in Wayne County, who is currently in low, and I were to walk into the store, I wouldn't be expected to necessarily wear a mask under the order. If I were to go to Wayne County in that same county the same night, and I was to go to a live concert where people are gathering together in a common venue, then we would all be expected to wear masks so that we can reduce the risk of one-to-many transmission. So that's what that would look like. The design is not to impose civil penalties or cause trouble with some sort of an enforcement method. That is not the intent. The intent is to state the severity. While the order is enforceable, our goal is for general cooperation so that we can move forward together in doing the right thing. That's what the order suggests. Yeah, go ahead.
Where did that cooperation come from? I guess that's where I'm confused. I mean, is this written so that police departments would be doing this, or health departments like they do for restaurants? I mean, who breaks up the wedding of 100 people where nobody's wearing a mask and everyone's inside? And there's, I mean,
even though that is enforceable by law, the hope is that that wouldn't take place because the people would use good judgment. But otherwise, it is enforceable the same as other similar situations under public health order or law.
Next question.
Yes, Governor, this is Jacob Klopfenstein with KSL.com. You touched on this a little bit, how, people might be becoming numb to the daily case counts and becoming, disengaged with this process of stopping the spread. This new system is complicated. It's a lot of information. How is the state going to work to, keep people engaged and, on board with stopping the spread?
Again, Dr. Saunders can talk about that, maybe Dr. Dunn. It is a learning process. We certainly have taken 7 months to learn what we had in place. It served us well, by the way, to get us to this point. With the last 4 weeks have been a little bit of a disappointment as we've had this tremendous surge, which is really causing us great concern, particularly in the medical community. So we're going to try to educate as we go. We've been working closely with legislative leadership, the local government officials, business communities, the health departments, our hospital associations, and those involved in the community to help them understand. They've helped us to, in fact, devise the plan that we have in place. So there's certainly a learning curve that's going to take place, but this is not going to end overnight. We'll have probably some suggestions of ways to improve it. This is certainly going to be something that we'll be able to adapt and modify and improve as we get new information or have questions that maybe we've not thought about to this point. So again, everybody needs to kind of get up to speed, and we'll learn as we go here. And we'll do our best to make sure that everybody has information of how to conduct themselves. It's not really rocket science when we're asking people to do. It's mostly common sense. And we're having a little bit better way to designate, maybe a little simpler to understand in 3 different categories. But I'm very confident the Utah people will be able to understand this and act accordingly. Again, Director Saunders.
I would just add to those very accurate comments that we are also developing a push strategy of the data so that we can make sure that, the more people know the score, the more engagement we will have, we believe. So we will be putting forth a push strategy of the information to make this available to as many people as possible in the counties. so that they can know, just like an air quality index or something similar. We push the information out, and then the expectation is that people will recognize it, be conscientious, and make behavioral adjustments because of it. In the end, there's no government control that's going to be sustainable over a longer period of, too much longer period of time. We have to eventually move forward toward local authority and just households making good judgment. So this is a step in that direction. We hope that people will be alert and attentive to the information that's pushed and that they'll make the adjustments necessary. And again, we'll make modifications and adjustments as necessary. Dr. Dunn, do you have anything to add to that? Or?
I think what's really encouraging here is that we are using data, which is an objective measure, to drive where counties are. And as Director Saunders represented, that this is going to be pushed to everybody. So it's all going to be very clear, how counties are in certain jurisdictions. So being able to really use the data to drive the impact and the interventions on the ground level in the counties is really a step in the right direction. So I'm excited to see this play out.
Take two more questions.
Yeah, hi, Paul Nelson from KSL News Radio, and I've met plenty of people who don't want to wear the mask. They're pretty obstinate, and they're defiant in saying, I'm not going to wear it. Without any real kind of teeth, without any kind of fine or citation, why should we expect people who have made the decision that they're just not going to wear them? Why should we expect them to change their behavior?
Well, LeVar Webb had a nice statement about that in his column on Utah policy. You could look it up. He talked about we wear the mask not because we have to. We should wear the mask because it's the right thing to do, and we're showing respect for our neighbors and our fellow man by making sure we do everything we can to not spread the virus innocently to somebody else and the ramifications of that. I would hope that people, rather than have it as a political statement, use it as a sign of respect for their fellow neighbors and their family members and the concern we have collectively as a state to make sure we have good health. We wear seat belts to protect our health and welfare. We have laws that we put on the books as we drive down the road at certain speed limits. There's a lot of things we do. The health department manages restaurants to make sure that when we go there to eat that we don't get infected with salmonella or some other problem at our restaurants. The statutes, in fact, empower us to make those kinds of judgments. That's the same thing today. So again, being a realist, I know that there's some people that say, you can't make me wear it. And so we know that some will not, for whatever reason they have in mind. But we hope the vast majority of people, and I believe the polling shows us and the observation we have is that most people, in fact, are wearing a mask, certainly much more than they have before. It's a different to our culture. It's something we have to change our habits and learn about. But if we really care about slowing the spread of this coronavirus and doing what we can to make sure that our hospital system stays healthy and our ability to help people with all kinds of illness, not just COVID-19, we'll all jump in together with an attitude of cooperation. So, Director Saunders?
I think I've heard the governor state before that, and I can't even count the number of people that have come to me with anger or venom in their veins saying that we have no right to force them to wear a mask. We don't want to force anyone to wear a mask. We just want masks to be worn because they work. Not for the rest of our lives, not to intentionally remove identity from individuals and separate households and families, which have all been accusations toward the government of what the accusations of what we're trying to do. Those are simply not true. I've heard the governor say before, if you're that insistent on not wearing a mask, if it's that big of a deal, what can you do to help with the cause? Because whether you wear a mask or not, we have this situation upon us. What can you do? Can you physically distance? Can you support in reducing the social gathering size? Can you promote other principles? Anything that we can collectively do. Now, the requirement is masks. And if you're simply unable to wear one or you do not, and it's that big of a situation to you, of a problem to you, then what can you do to help? Otherwise, wear a mask and cooperate with us on this. I myself have been anti-masking. I don't love wearing a mask, and I wear it almost every day, almost all day. I don't love to do it. But I believe in the data. I believe in the science. I've seen it. I've watched it happen. And so I wear a mask, even though I don't want to, because I believe it's the right thing to do.
I mentioned LeVar Webb's column. He concluded it by saying this, and I think it's kind of telling about some of the attitudes. He said some leaders he'd heard talk about said, what if we asked them to do something hard? It's not hard to wear a mask. It's easy for us to do, and it makes a big difference. It's the easiest thing we have out there, along with social distancing, to really stem the flow and the spread of this coronavirus. Last question.
Hi, this is Haley Hendricks with ABC4 News. So is there a plan to have more testing available based on the county's transmission level, like having more testing opportunities in a high level area versus low level? And then I do have a second part to that question.
Testing is important. Who wants? Dr. Dunn?
I mean, so statewide, we know that we need more access to testing. That is a principle that we're using to understand where spread is happening and what we need to do to control it. We've been really successful over the past several weeks. We're up to 10,000 people being tested every single day. So we are ensuring that, especially in areas that are hotspots, are getting access to testing. So that's something that's on our radar constantly. But it's really important also for all levels of transmission risk to have access to testing so that they know where the spread is happening in their own communities and we can keep them in the moderate or low. So this is all part of our testing strategy plan.
Okay, now with more testing, does it take longer for people to get their test results? Is there quite a backlog there? I know some people that it's taken days for them to know if they tested positive or negative.
I have heard anecdotes from a variety of people everywhere, ranging from it only took 24 hours to get my test results to it took a week. So I think there is a lot of variability that we're seeing right now. And part of it has to do with, of course, the demand, right? 10,000 people getting tested in a day is a significant jump from the 4,000 and 5,000 we were seeing. It's getting colder, so testing sites are going to start moving indoors. And so we are working towards figuring out what those barriers are to getting a quicker turnaround time. On average, as a state, though, we're just over 2 days for a turnaround time. We certainly want that to be faster, and it's something we're working with all of our partners to achieve.
Okay, thank you. And then these people who are waiting for test time, what are they supposed to do in the meantime? Is that something, are they supposed to stay home? Is that something that they're being told?
Absolutely. So if you have been a close contact or you have symptoms consistent with COVID-19 and you're waiting for your test result, it is super important that you do stay at home away from others awaiting your test results. Again, so that is a big reason why we also need to get our turnaround times faster so that people aren't waiting in limbo.
Thank you so much, Dr. Dunn.
I just wanted to add one comment to the question and to the responses that have been given. We have recently, in the recent week and a half, been meeting with the major hospital systems to work together on resolving some of the problems that deal with long waiting lines in the sample collection sites. We have come together in a very beautiful way with a very common mission to be able to disperse those constraint points and to be able to allow, with the oncoming testing technology, to be able to test, to have samples collected in many more places, even in your own home. And then the samples are sent into laboratories for processing. And in addition to this, there are, with the oncoming technology of rapid tests and a family of rapid tests, we're working to be able to place those throughout the state so that there can be more access to more testing by more individuals. And eventually, down the road, in hopefully the very near future, anybody that wants to be tested can be tested, and the constraint points that used to exist will no longer exist. So I just want to say that we're working together with the hospital systems and the Utah Public Health Laboratories to overcome these obstacles so that testing is not a constraint in this response.
Thank you for that.
Let me just sum up and say, again, our goal that we have here in the state of Utah is to minimize risk to all of our constituents here, the 3.2 million people of Utah at all age groups. We're trying to make sure that we have minimal impact negatively to our health, the individual health, and also at the same time make sure our economy continues to, in fact, to grow and be robust. And finding that right and appropriate balance is a challenge. What I want to say, as Director Saunders has said, we have been working together with so many different sectors of our society, the medical professionals, the scientists, the business community, our education, our religious organizations, all working together and trying to find what is the best way forward to minimize risk and protect the economy at the same time. Now, I want to just recognize that we have those we call vulnerable among us. They tend to be people over age 65, and they also tend to be people that have underlying conditions that make them more vulnerable to have severe reaction and potential death when they contract the coronavirus. We need to say to those folks, you have to be extra careful. It may not be fair, but that's the way it is in the reality of this COVID-19 virus. Those who are more vulnerable have to be extra careful, and those who work with them, those who are around them, family members, friends, caregivers, have to be extra careful to make sure they don't transmit the coronavirus to these vulnerable populations. So again, the only success we're going to have here is if we work together with a good attitude of saying, what can we do to make things better? We all have a role to play. We can, in fact, make things better. It is working all together. We, the people, can control the outcome of this issue. But we're trying to make that at a more localized level so that the local communities can make the determinations of what they want to do to make sure that their case rates are lower and that the hospitals are not being overrun in the medical system. But we, the people, can control the outcome. So let's have a siren call for all of us to work together as much as we can as we move forward here. Working together, we will defeat this battle with the coronavirus and the COVID-19 problems we face. And that's what we all want to do. I think everybody is engaged with that part. So let's find what parts we can play. What can I do? What can you do to make sure that we get across the finish line here and emerge victorious over the COVID-19? Thank you very much.
Thank you, Governor Herbert, Director Saunders, and Dr. Dunn. This will conclude the press briefing for today, and we expect to come back to you next week. So all the information that we talked about today is updated now. Last time I checked, the coronavirus website is live and functioning, coronavirus.utah.gov. Thank you.